Hey, it's Steve Grant here again today, and in this video I'm joined again by Lara Rickard, dietitian, and we're following on the theme of PCOS. And today, well, in this video specifically, we're going to talk about the diagnostic criteria, and then we're going to talk about some of the symptoms associated with one of those particular areas of the diagnostic criteria as well. So starting off with, do you want to kind of just jump in and talk about the diagnostic criteria?
So using the traditional diagnostic criteria, that's the Rotterdam criteria. And essentially it says any two of the following three criteria need to be met in order to have PCOS. So the first one of those three is cysts on the ovaries as seen on ultrasound, quote unquote cysts. The second one is lack of ovulation. And then the third one is high androgens, so the high, again, quote unquote, male hormones, either seen in signs and symptoms, so physical signs and symptoms, or in blood tests.
Cool. So the androgens, we're talking about testosterone, androstenedione, and DHEAS. Is that right?
That's correct. Yeah.
Perfect. So because obviously we've got cysts, there would be something that would be picked up on ultrasound, quote unquote cysts, would be picked up in ultrasound. Then we've got
lack of ovulation.
The lack of ovulation, which would be something that would be picked up as well. So androgens is a different one in the sense that in itself can cause a lot of symptoms in females, can't it? So do you want to just run through the kind of some of the classic symptoms that someone might experience with high androgens?
Sure. So our classic symptoms are going to be excess hair in places that we don't normally get it. So that's anywhere from chin, jawline, face, upper lip, chest, inner thighs, belly, and the back. We'll also tend to see balding, so they call it male pattern baldness, so typically on the temples. We can also see acne, so again jawline acne will definitely come through, and those are the three high androgen symptoms that will typically present.
So they're the really classic ones that if someone's often got PCOS, that they'll present with one or sometimes multiple of all of those as well.
Yeah, absolutely.
Okay, great. So anything you want to add to that?
Yeah, well, just going on from that with the high androgens, we've got that Rotterdam criteria, okay, which again says any two of those three criteria need to be met in order to be diagnosed with PCOS. But in more recent years, the Androgen Excess Society has actually stated, and this was confirmed last year at a PCOS conference or symposium, that high androgens have to form part of the PCOS diagnosis. So again, either seen in physical signs and symptoms or seen on blood tests. And then the lack of ovulation or the cysts you can have both of those or one of either of those.
I think this is really interesting because what you end up with is actually the androgens being possibly the most important part of the diagnostic criteria, but then the androgens not being mentioned in the title of the condition. So I think that's something to really think about in the sense that, and why we did a video on the naming of PCOS and why it is a little bit misleading, because actually a lot of the things that create the symptoms are not even thought of when you think of PCOS, and they're often completely overlooked. Absolutely. I'm guessing as well. So thanks for that, Lara, because I think it's really good to kind of clear that up and just highlight again the name PCOS and why it can actually be a little bit misleading. So in the next videos we're going to go into
what's actually driving those high androgens and then what we can do about that.
Brilliant. Tune in.